Hello everyone, welcome back to our channel. We are the BMSSA. This month, we chose to cover a disease concerning the digestive system. It is called celiac disease. So, what is celiac disease? Celiac disease is a hereditary autoimmune disease that damages the small intestine when triggered by gluten, a protein in foods such as wheat and barley. When gluten is detected within the body of someone with celiac disease, the immune system responds by attacking the gluten. However, these attacks also damage the hair-like projections along the walls of the small intestine, which are called villi. Villi are tasked with absorbing nutrients during digestion and are vital for maintaining good digestive health. When villi are damaged, patients experience villal atrophy, meaning that the villi have worn away over time from the immune system's response. Eventually, villal atrophy can lead to malnutrition caused by vitamin or mineral deficiencies. The symptoms of celiac disease can vary from person to person. Main indicators of celiac disease include diarrhea, gas and bloating, constipation, nausea and vomiting, weight loss, abdominal pain, and abnormalities in stool, such as pale stool, foul-smelling stool, and fatty stool or stool with mucus. The symptoms of celiac disease can often be disruptive to patients' lives and causes malnutrition and weight loss on top of being extremely uncomfortable. Many of those who suffer from celiac disease have to change their diet to avoid foods that include gluten, making it difficult to eat out with friends, as well as making groceries more expensive. One of the main concerns surrounding celiac disease is the potential for patients to develop anemia, osteoporosis, infertility, or cognitive or behavioral changes as a result of malnutrition. When food is vomited up or lost through diarrhea, or when the intestines are damaged long-term by inflammation, the body is unable to receive all the nutrients it needs to maintain normal functioning. Most often, people with celiac disease need to be tested regularly for any vitamin deficiencies, anemia, or changes in triglyceride levels and cholesterol. In some cases, patients will need to take vitamin supplements or receive further treatment for the side effects of having celiac disease.
Now, what causes celiac disease? Like many autoimmune conditions, the precise cause of celiac disease is unknown. However, there are several theorized factors that can cause or lead up to celiac disease. Genes have been found to possibly contribute to an intolerance to gluten in certain people. Other factors, such as one's diet during infancy, the presence of other stomach diseases, and the presence of gut bacteria, have been found to hold possible links to the development of celiac disease. In some cases, celiac disease has presented following surgery, labor, breastfeeding, infectious illness, or extreme emotional stress. Who does celiac disease affect, and what are some theorized risk factors? Celiac is a fairly common disease, affecting about 1 in every 100 people internationally. Despite how widespread it is, approximately 80% of those with celiac disease are undiagnosed and are therefore unaware that they have it. While there are no direct risk factors that can lead to the development of celiac disease in patients, it has been found that people with a family history of celiac disease are more likely to have it. Statistics have shown that celiac disease is most common amongst Caucasian females and those with certain other illnesses such as Down syndrome, Turner syndrome, and type 1 diabetes. How would we diagnose such a complex disease? Blood tests are the most common method of pinpointing celiac disease as a cause of gastrointestinal distress. Serology is the practice of observing blood serum for the purpose of diagnosing illness. In the case of a possible autoimmune disease such as celiac, serology looks at the level of antibodies within the blood to diagnose. Elevated levels of certain antibody proteins indicate an immune reaction to gluten. On top of serological testing, genetic testing can be used to look for human leukocyte antigens that can be used to rule out celiac disease. If either of these tests indicate the possible presence of celiac disease, an endoscopy could be used to analyze the small intestine for damaged villi. An endoscopy is a procedure involving the use of a camera to capture images on the inside of the body. As for treating celiac disease, the most common method involves adopting a strict gluten-free diet throughout a patient's lifetime. Common ingredients, including gluten, are grains like wheat, barley, malt, and rye. Common foods containing gluten are bread, pasta, baked goods, beverages like beer, and certain snack foods. Gluten can also be present in non-food products like medicine and cosmetics. Avoiding gluten entirely will help to heal the small intestine and reduce inflammation, meaning that patients will experience less pain and less symptoms of gastrointestinal distress. A dietitian or doctor can offer plans and advice to help manage and treat celiac disease within patients. Medical checkup appointments are key to making sure that patients stay on track with their diets, as well as receive the necessary vitamins, mineral supplements, or steroids for instances of severe or acute inflammation. By supporting scientific research into the science behind celiac disease, we can support those who may suffer from it. Feel free to check out our description if you're interested in donating to organizations that raise awareness for celiac disease, or if you'd like to learn more. Thank you for watching. If this video taught you anything new, feel free to leave a like and subscribe to our channel to learn more about different medical illnesses or diseases. Also, remember to turn on the notification button to be notified when our next video is posted.